Good morning. I'd like to call this public hearing of the House Children and Youth Committee to order. Just a reminder, this hearing is being recorded, so please silence your phones, and members, when you speak, please make sure the microphone is on. The green light will be lit. I'd like to start off with introductions. My name is Jeannie McNeil. I'm the chairwoman of the Children and Youth Committee from Lehigh County, and I'll defer to Chair Klunk.
Good morning. I'm Representative Kate Klunk. I am a Republican chair of this committee and would certainly love to hear from our testifiers today and our prime and co-sponsors on this bill. Looking forward to learning more. Thank you very much.
We'll go to my left. Would you like to start?
Representative Liz Hanbidge, the 61st in Montgomery County.
Nancy Genst, 152nd District in Montgomery County.
Jamie Flick, Williamsport, Lycoming County, and Union County.
Joe Hogan, Bucks County.
Jamie Walsh, Luzerne County.
Thank you. The purpose of today's hearing is to discuss House Bill 928, sponsored by Representative Bridget Kozarowski. House Bill 928 would require the use of EpiPens in daycare facilities. Chair Klunk, do you have any remarks? Then we'll proceed. Our testifiers today will be Thomas Silvera, Vice President, Executive Director, and co-founder, Elijah Alavi Foundation; Alexa Jordan, Advocacy and Policy Coordinator, Asthma and Allergy Foundation of America; Representative Kristen Marcel, co-prime sponsor; and Representative Bridget Kozarowski, prime sponsor of House Bill 928. Mr. Silvera, would you like to start?
Good morning, everyone. Thank you so much for meeting with us today. And this is actually my first in-person testimony. So a little exciting, but also something important that I would love to share with you all. So thank you, Children and Youth Committee, for taking the time out of your day to meet with us. I want to thank you for allowing me to speak today. My name is Thomas Silvera, and I'm deeply honored to be a part of this vital conversation regarding House Bill 928, an establishment of Elijah's Law. I come before you not as an advocate, but a father who lost his son to food allergies in New York City at a New York City child care center. At that child care center, they had fed him a food that he was definitely allergic to, and soon after passing away. The problem with that is that the educators knew that he was severely allergic, but did nothing to save his life. And that was on November 3rd, 2017. He was only 3 years old. And if you hear the nervousness in my voice, it's not being nervous, it's always the emotional grief that's always stricken, no matter how many times I do this. Elijah's Law was created to ensure that no other children suffers due to lack of preparedness. This legislation mandates food allergy and anaphylaxis training for child care staff, emergency action plan, and access to life-saving medication like epinephrine. This is not just an urban issue, it's a statewide one. More than 5.6 million children in the United States have food allergies, and a significant number of them are under the age of 5. This means that there are daycares or preschool settings where they depend entirely on the safety of adults. According to a national study, 1 to 5 anaphylactic reactions happen in a child care center, unbeknownst as well to the educator and the parents themselves. This means epinephrine must be readily available even for those not yet identified as allergic. One, I want to address this in the rural communities. The risks are even greater. Emergency response times are often longer, and access to pediatric specialists and allergist education resources are limited. Without proper training and protocol in place, a reaction that could be reversed in minutes can be fatal. Elijah's Law brings the tools of prevention to every corner of our state, rural, and urban areas. This bill has already passed in New York, Illinois, Maryland, Virginia, California, and just recently Arkansas. These states took action so families would not have to experience what mine did. And let's not wait for another child's life to be lost before we act. Members of this committee, I ask you today to please support House Bill 928. Vote A in this preparedness for education for access to life-saving medication. And if Elijah's mom was here with us today, she would tell you that change is a challenge, but a challenge is needed for change. And this is something we have to look at not just as a piece of legislation, but looking at it to save someone's life. Thank you.
Thank you for your testimony. I speak for myself, but I'm sure everyone else, my heart is broken for you and your family. And thank you for the courage to come and step forward and speak about this.
Thank you.
Our next testifier is Alexa Jordan.
Good morning. First of all, it's an honor to testify alongside Thomas. His advocacy has led to many state laws and vital changes in state policy, and so we're so grateful at the Asthma and Allergy Foundation to be here today with him. On behalf of the Asthma and Allergy Foundation of America and the more than 20 million Americans living with life-threatening food allergies, I'm here today to express our very, very strong support of House Bill 928, Elijah's Law. This bill is named in honor of Elijah Silvera, who passed away at age 3 while enrolled in a daycare program in Harlem in November 2017. Despite having a well-documented severe dairy allergy, Elijah was given a grilled cheese sandwich by an employee. Elijah went into severe anaphylactic shock and died. AFA is the leading patient organization for people with asthma and allergies, and the oldest asthma and allergy patient organization in the world. Kids with Food Allergies, a division of AFA, offers tools, education, and community to families and children coping with food allergies across the country. I am one of those 20 million Americans with food allergies, and I've had multiple severe anaphylactic reactions, which makes me so passionate about this work. Food allergies are affecting a growing number of American children and adults. Over 7% of all children in the United States have food allergies, with infants and toddlers ages 0 to 4 having a higher rate than any other age group. Exposure to the allergen can cause severe reactions, including anaphylaxis and, in some cases, death. Because there is no cure for food allergies, awareness and preparedness are key for protecting health and saving lives. One of the biggest challenges for childcare settings is that infants and toddlers are mostly nonverbal. Infants cannot talk about their symptoms, and caregivers must be properly trained to notice and identify the signs of an allergic reaction. In fact, AFA's research with leading food allergy experts found that signs and symptoms of anaphylaxis may actually present differently in infants and toddlers than in older children. Anaphylaxis is a severe allergic reaction. Young children in Pennsylvania who have severe food allergies always need access to epinephrine to promptly treat anaphylaxis in a trained adult who can administer it. In Pennsylvania, Elijah's Law would apply important allergy requirements to all child care providers. This bill requires daycare facilities to stock epinephrine and outlines training, storage, and emergency use procedures, including protections from liability for staff who administer epinephrine in good faith during an anaphylactic emergency. This bill also mandates that informational materials about allergic reactions and treatment protocols be distributed annually to parents of children in daycare centers. One preventable death of a young child is far too many. These requirements are evidence-based and will reduce reactions and risk for young children across the state. What's more, they will provide peace of mind to all of the families managing food allergies in Pennsylvania. This legislation is more than just a child care policy. It's a safety net for all children with food allergies, both known and unknown. By equipping child care centers with the necessary tools and training, we are preventing emergencies from becoming tragedies. Thank you so much for your time and consideration. We're so grateful for your work on this matter.
Thank you for your testimony. Representative Marcel is unable to be here at this moment, so we'll bring up Representative Kozarowski, who's the prime sponsor of the bill.
Good morning, and thank you very much for the opportunity to be here today to speak about House Bill 928. Thank you, Chairwoman McNeil and Chairwoman Klunk. I appreciate the time that you've given us to speak. Listening to Thomas, Elijah's dad, really, when you hear the story, the urgency to do something for daycare centers and child care centers there's no greater example after listening to Thomas and Elijah's loss. We have an opportunity to ensure that all of our child care centers and workforce is given the tools to be trained and to recognize anaphylaxis and the signs and symptoms of anaphylaxis in infants and children. So I am a nurse, and I've been a nurse for 28 years, and I worked in operating rooms. So when you think about a hospital, the best stacked department is the OR. We've got doctors and nurses and anesthesiologists and nurse anesthesia and respiratory therapists, surgeons, ENT docs. And I will tell you, I took care of lots of kids in my day, lots of kids having ear tubes put in, oral surgery, orthopedic surgery, and these little ones, I would take care of them before they went in the OR, send them off to the OR, but then I would wake them up in the PACU. So I worked in the pre-op and the PACU. And children are really, really like little Houdinis. They are unbelievably able to compensate. When they crash, they crash. You have absolutely no time. You have to be able to react very quickly. And even in a setting when you have trained anesthesiologists, nurses, nurse anesthesia, it's a stressful situation, and people are excited, and they are trained. So when you think about sending little ones off to daycares and work and child care centers, and they are already diagnosed with an allergy, it's a no-brainer to make sure those that are taking care of them during the day have the tools and the training to be able to make sure they recognize signs and symptoms before we come to a crisis. The other thing that's a parallel issue that I think about is what's happening in our Commonwealth with hospitals. You know, hospitals are closing across the Commonwealth. So when you think about the time that you need to get somebody to an emergency room, especially a little one, it's essential that those that are in their care during this anaphylactic reaction have the equipment with the tools to be able to stop it. We can stop it. It is preventable. It's preventable by training and you know, knowledge of what reactions these little ones will have if they are given these foods, right? So when you think about what we can do today here, and we think about stocking and educating workforce and child care centers, I believe that we will be able to support this. And I also wanted to highlight one other thing. You know, we've been working on this for a while, this legislation, and I do want to acknowledge my colleagues, and now certainly Representative Marcel, who's not able to be here with us today, but Chair Warner, did she just walk in as I said her name? She's magic. That's amazing. You come sit here with me. Yeah. You come sit right here. And Chair Solomon, all of them have worked on this legislation in the past, so I'm really, it's an honor to be able to speak to you all today about this. But before I hand the microphone over to Representative Marcel, I wanted to highlight Representative Curry also has a piece of legislation that I think is something that may help us not have to do what we're doing today. And her House bill is 672, and it's going to require health insurance plans to cover early introduction of dietary supplements to reduce food allergy treatment costs for families. And what that means is sometimes we've been trained over the years not to give babies peanut butter, honey, eggs, the highly allergic foods that we are told not to introduce to children. I think there's studies done in other countries, and we're kind of slowly catching up here, but I think it's important to educate how we introduce these foods to our little ones as they're growing at an earlier age, because maybe if we can do that, this is something that we won't have to do. We won't have such, because there's no doubt there's an enormous increase in kids that have really serious allergic reactions to foods, other than when, you know, I'll speak for myself. When I went to school, I only knew one little one that had a peanut allergy, but my children go to school with kids that had a vast amount of allergies. And so I think there's something other than making sure we're stocking our daycare centers with EpiPens and the tools and the education to be able to fight this. I think that if we can highlight the preventativeness of this, I think that would be something that really is important here in the Commonwealth. So I appreciate the opportunity to speak to you today, the open dialogue on this legislation, and to be eager to speak more about it. But thank you for having us here today, and certainly thank you for Thomas and his story about his son Elijah.
Thank you, Representative Kozarowski. Representative Marcel.
Thank you very much, Madam Chair. And thank you so much to Bridget for bringing this bill forward and working together with me on it. I'm here really to talk about this issue from a parent perspective. And just say a few remarks about my son. So I wanted to start off to say that obviously no one ever wants to have an emergency with their child. That's like the worst thing that could happen as a parent. You also don't want to be a parent that learns that their child has a food allergy in the middle of a reaction. And I know about that firsthand because of my son. We learned about my son's food allergy on his first birthday when he ate his first cupcake. What began as a joyful celebration quickly turned into an allergic reaction we didn't expect. That one moment set us on a path of allergy tests, doctor visits, hospital visits, and even one ambulance ride in a foreign country. Over the years, his list of allergies has grown from eggs to peanuts to tree nuts and some seeds. And that list may be growing, in the next few years too. He's 10 now. But it's scary when you're not sure when the next reaction may occur. The good thing is that now he is older. He's 10. He's much more aware of what he's allergic to. He's more aware of being able to ask before he eats anything. And he can now tell us, because he obviously can use words, that his mouth feels tingly, which is how he knows that there's an allergy. Obviously, for young children that don't have language skills yet, like all of those things are a problem when you're in a daycare setting. And even with all this awareness, we still have problems. We go to restaurants and we'll tell them about his allergies. We still are served meals and things that have those items in them just because of people being unaware, not, because of anything that is intentional. And so I'm here as a mother, as I said, as a mother of a child with food allergies. I actually always travel with Benadryl in case anyone ever needs Benadryl. I have it. I also make sure that anyone who watches him when I'm not home knows how to use an EpiPen, knows where the Benadryl is, how much to give him. And I still do worry about allergic reactions for foods that we aren't even aware of yet, as I mentioned. And that concern is, I would say, heightened when I'm not there, because as a mother, when you're not there, that's the part that scares you the most, and why I think this bill is important. It will give our daycare providers the tools, training, and support they need to respond when seconds count. As Bridget mentioned, depending on how far away a hospital is or someone that can help and make sure that that child is going to be okay. It provides access for EpiPens, strengthens training requirements, and makes sure that parents have better information. Finally, this bill brings peace of mind to families and gives providers the resources they need to act quickly in a crisis. And most of all, it can help to save a life. I'm very proud to support this, and I thank Bridget for all of her work to lead this effort. So thank you so much for having us today and considering this bill.
Thank you, Representative Marcel, for sharing your story. I now open the floor for questions. Representative Hambidge.
Just mainly an expression of gratitude, and particularly to Mr. Silvera. Thank you so much for your courage in working to save lives and change the world in Elijah's memory. I don't have a question for you. Basically, it's purely gratitude. And to the makers of the bill, I'm a mom of a young child with allergies. I always have an EpiPen with me. I also always send him to school every year with a new set of EpiPens. And I say, if another kid needs it, feel free to give it. And I've always wondered whether they can or they would or they will. And I hope no one ever needs it, but I've worried about the liability, the access, and whether they would feel comfortable giving it in an emergency situation. And I'm so grateful that the protections that you are trying to put in place would allow them to do so. So thank you.
Absolutely. And epinephrine is the first line of defense to actually stop an anaphylactic reaction. So, One thing is when someone is going through a reaction is to give epinephrine immediately and call 911. Simple as that. So that's why this bill it's a vital piece of legislation that will save lives. Look at it as you have schools that have fire drills. They have fire drills just in case there's a fire. They even have the school shooting drills just in case if there's a school shooting. It's almost having that type of knowledge and understanding of providing that care just in case. So we need that added type of coverage within a policy that will provide those protection, the access to epinephrine, the training, the guidance, and the policies that will actually continue to protect the most vulnerable, and those are the kids in child care centers. So thank you, guys.
Thank you. Representative Flick.
Thank you, Chair. Thank you to all of the testifiers for the great testimony. I'll echo Rep. Hambidge a little bit. And Thomas, I know it's been over a year since we've met and moved forward with this, and I will just say I can sense Elijah here today with you. So 11 right now?
Correct.
So thank you for helping to save lives, and on behalf of Elijah, thank you so much.
Thank you. Thank you so much.
Representative Walsh.
I just have just a few questions. Thank you for sharing your story. It's heartbreaking. My daughter had a febrile seizure at 3 years old, and it had nothing to do with this allergies. It was just some kids are prone to having febrile seizures, and we thought we were going to lose her. And tell you what, I don't know. You have a lot of strength for being here. But there are some questions just that I want to ask. The amount of funding that would be adequate for all daycare centers, do you know what kind of funding would be required? Does anybody know how much funding would be required to fund the daycare facilities in the Commonwealth?
So what we've been doing within the legislations across the U.S., especially New York, has been a big proponent of getting access to a federal child care block grant. New York has accessed that several times to actually give the child care centers access to epinephrine and also training as well. There's free training on a federal platform that can be accessed by the educators. And without kind of like taking away the time from the child care center, they can do it on their own time within whatever policy or guidelines the child care centers are working with them to get the access to training. So also with the epinephrine access, they can get access, Department of Children and Family Services, whichever runs those departments, can get access to the grants to supply these child care centers.
Thank you very much. Something that I don't know about, I know for my son, we had to always have an EpiPen. If a child care worker, let's say that they thought a child was having an allergic reaction and they administered epinephrine to someone that didn't actually need it, I don't know, are there any adverse effects? Could they cause some kind of reaction in that child if someone panicked and thought someone was having an allergic reaction and accidentally gave them an EpiPen?
So I can answer that. So one thing I know is like giving epinephrine to a child is not going to hurt them. It's actually what your body produces as well. This is synthetic epinephrine that's into the body, will cause probably an increase in heart rate and so forth. But it's also you take the child after the injection to the emergency just to follow up and make sure that they're okay. It's considered safe. It won't cause any harm. So there's even studies on that as well. If we can, we can provide that as well for you. So, and again, it's like if they give it, it's always good to give, especially if a child is, if unbeknownst, as I stated earlier, a reaction can happen unbeknownst to the parent knowing that their child had a reaction. It could be their first reaction in their child care center. So just to be safe, it's like when in doubt, give epinephrine. That's always the cause.
Very similar. I think, again, a big concern here that we have at AFA is for children who have unknown allergies, right? So just like Thomas was mentioning, we would not, I think the point of this bill is that we have those liability protections because we want to encourage fast and immediate treatment. But as, we can get some studies together to kind of demonstrate what we are talking about today.
Yeah, thank you very much.
Thank you. Chair Klunk?
Thank you, Chair McNeil, and again, thank you to all of our testifiers today for joining us. Mr. Silvera, thank you for sharing your story and for encouraging people to understand what these allergies mean to our children, what we need to do to prevent the situation that happened to Elijah, and really train people in how to identify this in children and how we can swiftly act to save them. So thank you so very much for joining us today. I did want to ask you if you're able to share with us, looking back on what happened to Elijah. We know that he was fed dairy, and that was on his list of items that he was not supposed to have. Do you know where the breakdown was related to him being served that grilled cheese sandwich and then not being administered the EpiPen that they had?
So
What happened there? So we can learn for the next case.
yeah, so as parents, with a child with food allergies, I also have another son who's 13. He's neurodivergent, but also has multiple food allergies. So he was in school. We as parents want to make sure we cross our T and dot our I's when we're looking for the right school for our child. So with Elijah, we looked into a child care center throughout New York, in Harlem where I live, throughout there, that can actually support Elijah's condition. Not only was he had food allergy, he was also an asthmatic. So those two together is almost a ticking time bomb. So when we found this child care center in Harlem, they assured us that they did understand how to administer epinephrine, how to give an asthma nebulizer treatment to a child. They did understand how to look for signs and symptoms. So that gives you peace of mind as a parent, correct? So assured us we were great. We provided all the medical forms that was needed from his provider. And, it was his first week of childcare. I think it wasn't a full week, you can say. So on that day, also Elijah had a specific designed food plan. He had a meal designed specifically for him that contained none of his allergens, which we worked with the child care center on. That day, the educator, he also had what they call as a CIT, which had almost like a paraprofessional with him. That educator at the time did not give him his specific meal plan, decided to give him the meal plan that was provided to the other children. Even Elijah being in his designated space for a child with food allergies, they still gave him the grilled cheese sandwich. With that was the disconnect. Also, what happened as well, they omitted from actually giving him the grilled cheese sandwich. It wasn't until the Department of Health did their investigation and the person had admitted that they gave him the grilled cheese sandwich. So them knowing that he is going through anaphylaxis, and anaphylaxis can pose different in everybody. It can be an internal reaction. It can be external as well from hives, but internally, especially with a child with asthma, they go through these symptoms. He was suffering from respiratory distress, also gastrointestinal issues as well. That can create a catalyst. And it's hard to listen to this, but this is something I have to keep playing over and over again every single day. So the disconnect is they didn't know how to identify the signs and symptoms. They knew where his epinephrine was at. So then they called the mom, which we lived 7 minutes away from the school, and still omitted from saying what had transpired. So it was her to do the investigation to find out what happened, and constantly doing, as anyone did as a parent, what did you give my son? And the omitting of what had happened, it had to go, it made her choose the direction to go immediately to the hospital, but she had to get police escorted to the hospital and then she made the decision and realized that he is suffering an anaphylactic reaction. The hospital did everything they can, administer multiple rounds of epinephrine. And that's why it's like giving epinephrine immediately when there's a reaction, even if that child poses some symptoms, it's going to save their life. If that educator knew how to understand the signs and symptoms, we all wouldn't be here talking about passing a bill for Elijah. And when we did our investigations and realized that there wasn't actually anything in place for children in child care centers for food allergies in New York. They had federal policy from K through 12. That's great. But what happened to the most vulnerable? The most vulnerable in childcare centers, them having their first reactions. We passed that law, became a mandated law. And then the other thing is, in childcare centers, they weren't allowed to call 911 until they call the parent first. So just to give you a premise and why I am doing what I'm doing today and why I'm fighting for not just, Elijah, I'm fighting for every child, every parent that has to move forward in the future that's going to have a child. Who knows if that child is going to develop a food allergy or not. So the disconnect is education. If we don't have the right education, the preparedness, and how to train them, how to identify signs and symptoms and give epinephrine, even if you're unsure, you're still saving someone's life. Thank you.
Wow. Thank you for sharing that. And now even knowing more details, wow. I can't imagine what you and, his mother went through. So it seems to be that the training really is the center of the need here. And so I wanted to ask some questions about the training. In the bill itself, I'm not seeing that the training is specific for identifying signs and symptoms in children. So I wanted to just dig down a little bit into this to see if the prime sponsor and co-prime might be willing to maybe take a look at that to make sure that we are ensuring that the training is, I think there's, just general training is good, but really making sure that we are training in identifying for children specifically, I think would be very important.
Okay, yes, good point. And I definitely will take a look at the actual, the training of the signs and symptoms. Like, I think that dealing with the population that we're dealing with, that age group, they are, like Representative Marcel and yourself, they are nonverbal sometimes. So to be able to train on recognizing signs and symptoms of anaphylaxis, especially if the child or the family is not even aware that is an allergen to them. So we can definitely look at specifically putting more verbiage on exactly how to identify specifically what they should be looking for. Because sometimes you hear asthma and anaphylaxis and you think they're going to turn red or they're going to stop, have signs and symptoms of breathing. And sometimes it's just they're vomiting. So you think, oh, they just have an upset belly, when actually that is a sign of a food allergen.
And that's what I've heard with so many of my, friends and family members who've had children like this. It's, they just thought that they had maybe a stomach bug or it was food poisoning, and it turned out that they had a severe allergy to egg or peanut or whatever it might be. So thank you for that. And I think the more information and direction that we give the department on this, I think the better. So going to the training, I believe, Mr. Silvera, you spoke about free training through a federal platform. Can you explain that? Because I think one of the questions that I got from providers when we asked was, how will this be made available to us? Will this be an additional cost to us? And even now, where can we go get that information without a bill to be able to educate our staff on this?
Yeah, and that's also the access to the federal child care block grant will also provide that access for resource. And there are multiple platforms out there that give free education, free food allergy training. And the federal platform I mentioned is that New York State created Elijah's Law Food Allergy Training, and that is accessible through any child care center across the state. It's just getting access to that. I know they would love to have been here to testify, and they had said if this bill passes, they are more than happy to work with Pennsylvania to make sure that everything is done right to keep a child safe. So that platform is accessible. And there's other platforms as well. There's AFR and other platforms that offer free training as well. So it will not be a cost to the educators. It's like if they do these food allergy training on their own time, it doesn't, it wouldn't cost the child care centers anything if they do it that way. It just makes it a little bit easier. It doesn't create a burden or anything cumbersome for these educators or directors for these facilities.
Okay, so in the states that have implemented this, there has not been a cost to these providers as long as it's being run through the federal
If they get access to the
asset.
federal.
Okay, that's really good to know.
Even if, I'm sorry, but the training is there if they want it, even if they didn't get access to it. It's free.
It is for, okay, thank you.
Yeah.
And that's just good for us to be able to share with
Yeah.
our providers as, you know, we're just walking about and visiting them like we do as state representatives. And I just wanted to confirm, based on the language, that daycare facilities would not be required to stock these EpiPens unless there is a funding stream through the department to be able to administer a free program to give these to the daycares.
Correct.
Okay. That was a question that we, you know,
And those are
received.
good, those are the really good questions when you think about, okay, this, obviously we need to do this, but how are we going to do this? How are you going to train everybody? Where's the access? How are they going to, is it something that is a criteria for hiring? Do they have to have a, 2 hours of training? And sometimes there's people that can come to the site, there's video training. And then actually having the access to the medicine to have in-house, yes, that will be something that we can provide funding for.
Okay, thank you. Do we have any statistics related to how often this happens in our daycare facilities?
Statistics is like, when we throw numbers, it becomes alarming. But I know in New York, there are already 4 lives saved due to Elijah's Law. Just because there's a law that's in place to save a life. So if we look at numbers, the numbers are astronomically growing when it comes to children with food allergies. And it's going to continue growing. So if I give you a number, it's not going to change a person saving a life. So I can't give you a definitive number. But I know it's 5.6 million children with food allergies, I believe, around that area. But we're talking about, those who are not diagnosed with food allergies having the reaction. So if there was 4 lives saved through this training specifically, we can look at possible other lives being saved in other states as well.
Well, and just having people in our communities that are trained,
Correct.
it might not be at a daycare, it could be at your child's, after your child's t-ball game.
Yeah.
We always, I'm the coach of my daughter's t-ball game, and we always have snack afterwards, and we always ask, what are your child's food allergies?
Yeah.
And I impress upon parents, please check every label, please. And the parents check too, who would know
Yeah.
that they have their children
think
with the allergies.
the-
But having somebody there who knows too, they ate an Oreo and they can't have the Oreo. Quick, get the EpiPen.
Yeah.
Somebody, let's help them. Call 911.
Within that legislation in New York also saved an adult educator's life because of that. Because there were accessible epinephrine at that childcare center and that they were able to get access to that weight-based dose epinephrine to save that educator's life as well.
I was just thinking, real quick, I just said to Kristen, we probably could get those statistics. How many children in the Commonwealth have been treated in emergency room settings with an anaphylactic reaction in that age group? That's something we could probably get for you, I would think.
I think so too. I will say so we do lots of different types of food allergy statistics that we're looking at AFA. Oftentimes, the incidence of reported allergic reactions is often lower than it actually is because it's sometimes hard, like you were saying, with the different types of signs and symptoms that children might present with throwing up versus, some of the adult symptoms like, I can feel my throat is closing, right? So when you don't have those exact same just the tracking of the incidents is slightly harder. But what we can share right now is that, 7% of all children, when you look at a classroom, that's approximately, 1 in 10. So if it's a class of 20 kids, 2 kids have a severe food allergy, right? So, and if you look at all the times we eat in a day, right? If we eat during our childcare time, how many risk, opportunities are there? The risk is actually quite large for a lot of children. And so, we have to continue working together with the childcare providers, as well as parents. You know, I think what, you know, stands out to me in your story is that they already had a plan in place, right? But there's still some training barriers that we have there too. And I think that that can help, you know, over time, a lot of those incidents tracking numbers will continue to improve as we're able to accurately identify when anaphylaxis is happening in children.
Thank you. And I have one last question, Madam Chair. So in subsection D1, the Department of Health, in consultation with DHS, is required to develop informational materials to the daycare facilities and distribute that information to parents and guardians of the children in their care within 90 days of the effective date of that subsection. Do we know in other states, has that been the timeline for implementation for that? Is that reasonable? Could it be shorter? Does it need to be longer? Any thoughts on that?
Yeah. So to go back to New York has been like very successful on doing that, providing dear provider letters to the child care center. So just recently, they just posted one, both English and Spanish, to providers for Food Allergy Awareness Month, which is this month. So they've been very sufficient in putting that information out. Again, they had said they will work with Pennsylvania and give them all the vital information to provide whatever access for the child care educators, directors, whatever centers. They will give them that information, and that's what New York has been grateful in doing. It's like even with California, they've been, you know, open to providing information to them as well, and getting that information. If they work with the departments, you know, and we can give them exactly what they've been doing, and it makes it easier for them to follow the same thing.
And that's great to know that there's a copy paste, you know, program out there that we could follow. Just a quick follow up to that. So they have the information in English and Spanish. I have a bilingual daycare that just opened up last year in my community to serve our Hispanic speaking parents and children. So is the training also
Yes.
in Spanish too?
Yes. It's in English and in Spanish.
English and in Spanish. That's fantastic. And that's maybe something that we could make sure is in the bill. You know, and maybe through an amendment, Representative Kozarowski, maybe we could work on something with that to make sure that that is also, you know, impressed upon the department that we need to make sure there's access, especially for Spanish speakers.
Yeah, absolutely, and thank you for highlighting that. And I'm all about moving things along faster. So yes, if we can get it in 30 days after, but I think certainly with the copy and paste, I don't think that should be a problem for the department to be able to provide those information. So yes, thank you.
Thank you so very much, and thank you again to our testifiers. Thank you for bringing this bill forward. It's just great to hear that you are trying to tackle an issue that is, you know, out there. It's real for our parents and our children. There are ways that we can, you know, equip our daycare facilities with the tools that they need to save our children's lives. And it's just great to know that we have, you know, partners out in the community willing to work with us to try and make this happen. So thank you.
Yeah, one of the things we do, even within our organization, I am like literally on the phone with every state, making sure that they're in like taking the steps needed to make sure that these childcare centers are safe. And that's what we do within an organization, and even on a collaborative effort, this is what we do. We want to make sure that these states that adopt Elijah's Law are actually working with us and making sure we're keeping everyone safe and giving parents peace of mind.
Thank you, Chair Klunk. I want to thank all of you for testifying. Thomas, thank you for sharing your story. The courage you have to keep doing this to make sure it doesn't happen to anyone else is amazing. Many years ago, I worked in a school nurse's office in a high school, and a young man, 17, came in with visible reaction to a food he ate, never had an issue in his life. My colleague quickly reached for someone else's EpiPen and saved this young man's life. So this is definitely needed. Know that we will be scheduling a voting meeting on this when we come back in June. Thank you, everyone.
Thank you. Thank you.